there's obviously some controversy around hormone replacement therapy where people say, well, is that risky? Is that something I really want to do? A lot of doctors are still a little timid about it or not sure how to talk about it. A lot of them aren't very well informed about hormone replacement therapy, and yet there's some that are, absolutely gung ho and love it. So why is there such a discrepancy, or so much a divide between practitioners, physicians who are saying, I don't know, it may seem risky. Maybe you need a antidepressant, versus those who are saying this is the best thing you could possibly do for your quality of life and to prevent disease. There seems like there's quite a gap there between those two things. So what happened? Because didn't this used to be fairly normal? Like treating women for menopause was a common thing in the 70s and 80s, wasn't it?
Well, no, it's not. That's not ever been really common, actually. It was always considered like a normal part of aging. But there was the crazy thing about it is if a child was tested and their hormone levels were off, they would correct it immediately, right? They wouldn't just say, oh, well, this is just how you are. This is normal for you. This is no big deal. But as we age, for some reason, when our hormone levels are thrown off, we're hesitant about correcting that, or we're hesitant about replacing that. So I think, one of the big things that happened when that Women's Health Initiative came out, and
That was in the 90s.
right, 90s, early 2000s, and there was a big scare. It was first of all, had to do with synthetic hormone replacement. There was parameters around that study that were very different than if we're talking about bioidentical hormone replacement therapy today. So start with synthetic hormones. There were some adverse responses. These were in women primarily around the age of 65 who had already been postmenopausal for about 10 years. So the guidelines behind that were very different. It got pulled. It got some very bad press, and that was the end of it. And it scared everybody, and that was it. Hormone replacement therapy is bad.
Well, I think there were some issues with the way they released or interpreted the data as well.
Correct. Right.
So they had a very small increase in the amount of women who had the adverse effect was breast cancer, right?
Hmm.
And so instead of it being in the control group, they had 3 out of 1,000 who had breast cancer, which was kind of standard, typical. They got breast cancer, and those were the people who didn't have the hormone replacement therapy. Those that did, it went from 3 out of 1,000 to 4 out of 1,000. Well, it's not a statistically significant a number increase. No one died. None of them were fatal. But the little increase there, it's in how you communicate it. 3 out of 1,000 to 4 out of 1,000, not statistically significant. When you say there was a 25% increase in the incidence of breast cancer, well, then technically that's true, because you went from 3 to 4. That's a 25% increase or 30% increase. But when you look at in the larger scope of 1,000 women, it went from 3 to 4. That would not be considered statistically significant or anything you would report on. So in how they communicated the data, I think there was one other issue with it, with a lot of the women who were supposed to be in the control group who didn't have not having hormones. At some point in their past, many of them in that control group had some form of hormone replacement therapy. So it wasn't even a clean control group where you had women without any hormone replacement. So there were so many issues with that study, but it's created a lot of confusion, a lot of fear. And then they
And it
really,
was splashed. The headlines were splashed all over the
oh, it was on
place
Good Morning America.
with very little depth to the information or accuracy.
And from that point, they actually stopped training a lot of doctors on it in med school. A lot of med schools, just because of that came out, they stopped training doctors on hormone replacement therapy and treating women and postmenopausal women with hormones. And it just shut down an entire area of medicine.
Yeah.
With that one press release.
Right.
And so it was fear.
Yeah. Fear-based. And so thankfully, there has been great strides in the study for bioidentical hormone replacement therapy. Studies after studies, there's quite a bit of depth there, and the safety of of bioidentical. And not only that, not just the safety, but the impact on quality of aging, the impact on quality of life as we age, in helping to stave off some of those big scary things like osteoporosis, dementia, heart disease, metabolic, diabetes.
Yeah.
Right.
Insulin
So
resistance.
yeah, all those those big scary things that sort of snowball, bioidentical hormone replacement therapy has been a game changer in the aging category.
For sure.
So not only does it make you feel better, you know, at different stages of your life and help you to perform the way you did when you were younger, it does actually have an impact on the way you age and the pace at which you age,
Yeah.
adding quality to your years, not just years to your years. Because
Right.
we really, I mean, there's a big difference between, you know,
It's lifespan versus health span.
right. That's it. Yeah, that's what
Basically,
I was trying to get at. Thank you.
lifespan being more years, health span being the number of years you're actually still healthy and active and taking care of yourself before you die. So,
Right.
because most people, the last 15, 20 years of their life are really not great,
Not a pretty picture.
not ideal.
Right.
And
right.
so if you can cut that short down to the last 6 months or just not pretty, then you win.
Right. Right.
So that's where I think there more education is obviously needed, but there are people who took the chance, who are out there creating their own practices or treating people with hormone replacement, who have done the research. And it's important to find those practitioners to help you walk this out.
Right. So if you
Because
need more information about what we're talking about, we have a free download. You can educate yourself. It's going to give you some great basic information, some levels, some optimal levels, like what's normal, what's optimal, and that'll give you a place to start.